promising therapy for diabetes. And so, what we would like to show as a backgrounder is that we know that diabetes is a global pandemic. And of course, as we will see subsequently, the increase in the number of people with diabetes is very much felt in our region. And so the expected number of diabetes will be increasing by as much as 72% by the year 2025 worldwide. But the most important findings or estimate is that as we go through the different regions of the world, we will see that a major part of the increase in the number of people with diabetes will be from the developing region. As you can see, this is the Asian region, and we are part of that contribution. So the global pandemic of diabetes is really much felt in our region. And so we have seen this slide a lot, and we know that we've been told that the basic defects in type 2 diabetes will be your beta cell dysfunction causing impairment of your insulin release, as well as impaired action of your insulin at the tissue level, what we call insulin resistance. So we have here the impaired action in the liver, decreased glucose uptake in the muscle, as well as increased fatty acid release from your adipose tissue. And so all of this will result in significant hyperglycemia, and all of these are also associated with production of many so-called inflammatory markers that predispose to vascular disease. Now, so we know that eventually all diabetics will have vascular disease, whether it's microvascular or macrovascular. Now, specifically for the type 2 diabetes, cardiovascular disease will be the main exit of these patients. No? And so we have here myocardial infarction, stroke, as well as peripheral vascular disease. Of course, everywhere around the world, even in the Philippines, the microvascular complications of diabetes are predominantly the cause or leading cause of renal failure, blindness, as well as neuropathy. So again, this just sums up the main problem, the challenge that we have to deal with in managing diabetes. Of course, there are many so-called landmark trials, not only for type 1 but for type 2 diabetes, and this is from the United Kingdom Prospective Diabetes Study. Again, this is simply showing to us that as your blood sugar control gets worse, as shown by your glycohemoglobin here, once it goes up, your risk for complication also goes up. So the UKPDS is a big trial composed of almost 4,500 patients in the United Kingdom, and they were prospectively followed up for more than 10 years, no? Average of about 9 years. So again, we have solid evidence that if we control our sugars better, we will have lower risk of complication in the long term. And again, we know that there are so many drugs that we have been using for a while to control diabetes, and yet we seem to be not getting good decrease in the complications. So, you know, I'm sure all of you have seen people with very bad peripheral vascular disease, with repeat amputation, pataas ng putol, and then of course your renal failure patients, many of them are diabetics. And so, as you can see here, this just summarizes for us the different available medications that we use, aside from insulin, to lower your blood sugar. So from the pancreas, acting on the pancreatic beta cells, of course, we have your sulfonylureas and glitinides. So we have leventhlamide, glycoside, and your noble repugnite here, no? And for biguanide, this is the oldest group for your oral agents, and this is followed by your biguanides, your metformin, which improve the effect of insulin in the liver, so that inhibit glucose production in the liver, even in the fasting state. No? So this is also the site of action for the PCDs, which is a much newer drug agent. It is important to note that we have been using metformin much longer than the Western world. No? So metformin was only approved in the US in the early 90s, whereas we've been using it siguro 80s pa. No? And again, in the muscle, the so-called insulin sensitizer, biguanides, and your PCDs will improve glucose uptake, you know, and also in the adipose tissue. So in the end, all of this should be able to significantly lower down the sugars. But then the reality is that we're not able to really meet target in at least 50% of most patients. We see that the current recommendation is really to get to near normal sugar levels. So the nearer we are to normal, the less complications we expect. Of course, there are questions now. I'm sure you've heard about the recent release of big studies that focus on very high-risk type 2 diabetes, the ACCORD trial as well as the ADVANCE trial. And there have been fears that probably two-type control can lead to increased cardiovascular risk. And of course, we've also heard about the fear with the TCDs lately, of course, that is being debunked left and right by the manufacturer of Avandia. And so, but then there's still no solid conclusion about the possible cardiovascular safety profile of PCD, of Avandia. Of course, I think in practice we still use it a lot, and there's still no definite reason to pull it out. And I guess we really need to just individualize our treatment.